Dear friends, now we will discuss about the long thoracic nerve. In this picture, you are seeing the scapula wherein its medial margin and inferior angle you are seeing behind. Then on the front you are seeing the first 8 ribs and their costal cartilages. Then you are seeing 8 digitations of a muscle which is known as the serratus anterior muscle. Serratus anterior muscle is a broad sheet of muscle which covers the side wall of the thorax. It originates by 8 digitations from the upper 8 ribs which you are seeing in this picture, and it gets inserted into the costal surface of the scapula along its medial border. The first 2 digitations they get inserted in the superior angle. The next 2 digitations they get inserted along the medial border, and the lower 4 digitations they get inserted into the inferior angle. And you are seeing a nerve that is passing anterior to the serratus anterior muscle and giving nerve supply to all of its digitations. This is the long thoracic nerve, and it takes origin from the C5, C6, C7 roots of the brachial plexus. So with this introduction, we will go into the details of the long thoracic nerve. Now let us see a clinical case scenario. A laborer who carries heavy weights on his right shoulder complained of pain in the scapula and shoulder, discomfort when sitting against a chair. On examination, it was observed that the inferior angle of scapula was rotated medially, as you are seeing in this picture, and the medial border of scapula was prominent. After seeing that case, you should be able to answer the following questions. What do you call this condition? What is the cause for this condition? Why there is prominence of vertebral border of scapula? And how will you test the patient? So to get answers for these questions, let us learn about the long thoracic nerve of Bell, which we call it, and then at the end of this discussion you will be able to answer these questions. The objectives for this lecture are, at the end of this lecture the student should be able to answer to a question wherein he or she is asked to describe the origin, root value, course, distribution, surface marking, and clinical importance of long thoracic nerve. The long thoracic nerve is also known as long thoracic nerve of Bell. It's also known as the nerve to serratus anterior. The other names for it are the external respiratory nerve of Bell, because serratus anterior muscle is taking part in the respiration, and the other name for it is the posterior thoracic nerve. The long thoracic nerve is innervating the muscle, that is serratus anterior, which anchors the scapula to the thoracic wall. The root value of this nerve is C5, C6, C7. So it takes origin from the roots of brachial plexus. So the ventral rami of C5, C6, C7 contribute for the formation of long thoracic nerve. Coming to the course, distribution and surface marking of the long thoracic nerve. It begins in the neck and pierces the scalenus medius muscle and runs downwards over the scalene muscles, and it enters the axilla at its apex between the clavicle and first rib. Then it descends behind the axillary vessels in the axilla. Then it travels along the medial wall of axilla over the serratus anterior muscle in the mid-axillary line. So now you know what is the surface marking for this nerve is along the mid-axillary line. Then it reaches up to the lower border of serratus anterior muscle, and it gives twigs to its digitations. So for each digitation it will give a separate twig. So that is about the course, distribution and feeling for the long thoracic nerve along the mid-axillary line. Now coming to the clinical anatomy or the applied importance of the long thoracic nerve. There is what is known as winging of scapula. Let us recollect the case scenario which I have presented at the beginning of this lecture about a laborer. The long course of the long thoracic nerve through scalenus medius make it susceptible for injury, as it is lying in the posterior triangle of the neck, and any pressure on the posterior triangle due to carrying heavy weights in the case of laborers, or in case of stab injuries in violence. Injury to this nerve produces winging of scapula due to paralysis of serratus anterior muscle, which moves the scapula forward, which is known as protraction or pushing movements. When the muscle is paralyzed, the medial margin of scapula projects backwards, and it is known as the winging of scapula. Now let us answer for the clinical case scenario which you have seen at the beginning of this lecture. Try to recollect. So what do you call this condition? So this condition is called winging of the scapula. So the scapula here is seen like a wing. What is the cause for this condition? This is due to injury to the long thoracic nerve of Bell that supplies the serratus anterior muscle. It can be due to any one of these causes. So it is more common in persons who carry heavy weight on their shoulders, as was the case in the present clinical case. Or it can be due to blows on the posterior triangle of neck. It can also result during the surgical procedure of radical mastectomy. Then why there is prominence of vertebral border of scapula? Normally, the serratus anterior along with trapezius, it helps in overhead abduction of the arm by rotating the scapula forwards. This movement is not possible when the nerve is injured. In the absence of forward movement of scapula, the rhomboids and levator scapulae muscles, so that will be attached along the dorsal aspect of the medial border of scapula. They pull the medial border and make it prominent. How will you test the patient? That is the last question. The serratus anterior muscle can be tested by asking the patient to stretch his upper limbs forward and place his palms against a wall and push them against that wall. So that makes the serratus anterior, which gets stretched, and then you can see whether there is winging is prominent in this position. So you have learnt about the long thoracic nerve. So the long thoracic nerve of Bell, we call it, and it is other name is nerve to serratus anterior, as it supplies that muscle, giving separate branch to each of its 8 digitations, and it arises from the C5, 6, 7 roots of the brachial plexus. And paralysis of this muscle, which is supplied by the long thoracic nerve, causes winging of scapula, and paralysis of this can lead to loss of overhead abduction. So hope you have understood about the long thoracic nerve of Bell or nerve to serratus anterior.